hope you all are doing well. Welcome back, and for those of you who are new, my name is Alexis. So today I'm going to be giving some advice for new nurses, and of course I myself am still a new nurse, but I found it to be a lot easier to talk to new nurses who have only been working for a few months or maybe like 2 or 3 years, because their experience with orientation and transitioning from being a nursing student to a nurse is a lot fresher on their minds. So I've been working as a nurse for 5 months now, and I've been off orientation and on my own with my own patients for about 8 weeks now. So let's go ahead and get started with these tips. My first tip is to go in with an open mind. So you may have an idea of what you would be doing on your unit as whatever nurse you are, but you never know what new experiences you're going to have. For example, I work in the NICU, and they expect us to cross-train so that we can float in the PICU, and we also have to go to L&D and help out with deliveries. So it's just good to keep an open mind and try new things, be flexible, because you never know. You might really enjoy trying these different things. Like I might really love going to the PICU or going into L&D, so just keep an open mind. My second tip is very important. It is to make sure you ask questions and ask for help. I cannot stress this enough, okay? People are not going to know that you have a question if you don't say anything. So it's kind of like the saying, closed mouths don't get fed. I'm very shy, so it's really hard for me to kind of, ask all these questions, but I found that it was the best way for me to learn. You don't want to be out here trying to do new things if you don't really know what you're doing. Like, you don't want to try to change a line being completely clueless, because you may not do it sterilely and you can cause your patient to get an infection, or you might have air bubbles in the line. You don't want to try to do like an art stick without, knowing what you're doing. So make sure you ask questions. You have a lot of resources as a new nurse, so make sure that you use them, especially your preceptor. Make sure you're paying attention to what your preceptor is telling you. Don't just, show up to work and just be in la la land. You really want to be paying attention. Also, I do want to say that once you become a nurse, don't think that the studying is over. You may have graduated from nursing school, passed the NCLEX, but guess what? You're still going to be learning, and you still do have to do some kind of studying. So when I was first starting off as a new nurse, I would take notes both inside and outside of work. I found myself asking like the same questions over and over, and I was like, okay, Alexis, you need to start writing things down. Also, if I have a patient now who has a condition that I've never heard of, whenever I have downtime, I like to just go on Google or whatever and look up that patient's condition so I can learn a little bit more about it and be more aware. My third tip is to just be a good employee. You want to make sure you make a good first impression. You want to smile, and be friendly, be professional, be on time. So you just want to be a good, kind person, because no one is going to want to help you if you're not nice. And as a new nurse, you're going to need a lot of help. So make sure you make a great first impression and continue to just be friendly, even after your first few months at work. My next tip is to establish a routine. Now, this has been extremely helpful for me. So if you saw my video about my typical shift as a NICU nurse, you'll see that I like to do things in a certain order as much as I can, because it really helps out. So once you establish your routine, you'll see what works for you, what doesn't work for you, and also it will help you remember things. So for example, let's say you do your head to toe assessment. It's a lot easier if you go in the same order each time, because if you don't, you're more likely to forget something. So if I go out of order when I do my assessment, let's say I forget to take a temperature because I did something in a different order, as soon as I sit down thinking that I'm done with my patient, I'm like, oh my gosh, I forgot to do a temperature. So it's really good to establish a routine as a new nurse. My next tip is to remember self-care. A lot of times at work, we don't go to the bathroom, we take a late lunch, we don't drink enough water. So these are things that you just want to keep in mind. Like just yesterday at work, I didn't go on lunch until 8 hours into my 12-hour shift, which is not great, but sometimes it happens. Every time I was getting ready to go to lunch, something would come up and I would have to do something. So just make sure you are taking care of yourself. Even outside of work, you do want to make sure you practice self-care. So if that's like going to the gym, going out with friends, taking extra naps, just make sure you are taking care of yourself, because working as a nurse can be draining. We only work 3 days a week for full time, but sometimes you really do need 4 days out the week to recover, because those shifts can be very long. So just make sure you are taking care of yourself, especially when it comes to hard things like losing the patient that you've become close to. My next tip is to make sure you acknowledge your weaknesses and work on them. So when I was in orientation, I really struggled with hill sticks. Also really struggled with getting bubble CPAP to work. So these are things that I definitely acknowledged, and I made sure I asked other people for help and to just give me tips on how to be better at it. And it was crazy, as soon as I got off orientation, I started doing really well on hill sticks, because I was like, I'm on my own now. The pressure was on. I was like, I have to do this. But I did not start getting good at that until after I made sure I asked for help and after I acknowledged those as my weaknesses. It's really important that you work on the things that you are struggling with, because if you don't practice, you're not going to get better. It's just like the saying, practice makes perfect. My final tip for you is to be patient. It really does take time to get used to being a new nurse. I'm still obviously learning. I haven't even hit my 1-year mark, and everyone says the first year is usually the hardest. So if you're really struggling with things, don't beat yourself up. I would be really upset with not being able to get hill sticks when I was in orientation, but look at me now. I'm able to do it. So just give yourself time and you'll be fine. You'll be a great nurse. Also, don't rush through orientation. I know you can be very eager to be on your own and have your own patients, but you really should enjoy it, because it's great to have someone by your side helping you out every single day. So those are my top tips for new nurses. I hope that you guys found them to be pretty helpful. If you have any questions, of course, I'll be there to answer them, and good luck to you all starting your new jobs. I will catch you all in the next video, and I hope that you all have a lovely day. Bye!